When my husband lost his job the end of March of this year, we lost all of our benefits, and I take health sustaining meds, so that was a concern for us. But we figured that maybe, you know, we'll just pray and hope for the best, and, you know, we'll be fine. And 3 weeks ago on the 21st, I was at home, I was working on the computer. I got up, turned around, tripped with my left foot, fell on my right, crushed some bones in my foot, did some stuff to the joint. I was 4 days in the hospital, CAT scans, doctors, orthopedic surgeons. They're telling me the bills are going to top out at over $40,000 just for the 4 days. And we have no insurance, we have nothing. And that's a real concern. We didn't expect this to happen at all. And there's so many people that are like us, that are uninsured, underinsured. It's past being a crisis in this nation. It shouldn't happen. Something has to be done. My husband took me to the hospital, and I didn't want to stay. He can tell you. And I mean, it was a fight to get me to stay. I thought I dislocated it, it'll be fine. I had no idea that I had done that, and I did not want to stay. And it was awful. And that's a lot of money. You know, a few thousand more dollars and we could pay off our house. You know, when you equate it that way, it's awful. And now I worry about everything. You know, what if something else happens? At some point, the federal government held the hospital's feet to the fire and said, if you accept federal funds, you have to take people that are uninsured and underinsured. And they did. Sadly, it's not the same thing with the health insurance companies. All I keep hearing from anybody that I talk to is they have a huge lobby and that they're very powerful. I think it's time, you know, the governor has a lot of influence and he's got a lot of power, and I think it's time that we started taking the power away from the insurance companies. I think the same thing should be done to them that was done to the hospitals. I see a lot of, I'm the director of the Pennsylvania Coalition to End Homelessness. A lot of the people that I work with, they use the ER like you and I would use a primary care physician. And that's an added burden to hospitals that are already straining with charity care. Something needs to be done, and we really need to hold the health insurance companies accountable. I'm not opposed to the governor's health care plan. I just think that we need to take a second look at the health insurance companies. And I think we need to, I gotta tell you guys, here's the deal. If we start going after the healthcare companies and their image starts being a little bit tarnished, they're gonna come around to somebody's way of thinking because they can't afford a bad public image. They just can't.